Okay, welcome. This is Dr. Jerry Cuomo. It is Thursday, March 21st, 2013. I'm here with my patient to resolve a loose screw, implant screw dilemma. This particular case involves two Frylight implant crowns that are joined together. And right now, from what we understand, is the the implant abutment screws are loose. The crowns are cemented to the abutments with a temporary cement, but they were unable to be retrieved through conventional means. So we're dealing now with basically two loose abutments and crowns all attached as one piece. All right, so first of all, I'm going to demonstrate that they do move laterally. We did anesthetize her, so we're good to go. Step one is to gain access. A fresh 330, please. Two. Just set them here. May have another cup container. Alright, so we're through the porcelain. Now we're going to go ahead and get through the metal. We're going to look for a cement line. And I'm going to use a 330 carbide for that. Small section. Dry the tooth. Okay. Okay, so we just found our opening. Dry the tooth. And it's a white material, so there's the tampon. So access hole obtained on number 13. Now we're going to do 14 is next. And we'll use a fresh spur for that. How you doing? Okay? Good. Okay. And I'm going to move to a smaller mirror. There we go. Okay. Long Explorer.
Doing okay? Mm-hmm. Great. Moving right along.
Another Long Explorer. Scalar next. And that looks like there's cement, so that doesn't look like a screw. Looks like we just need to go a little further. I'll take another look at that. Should be the top of the abutment. So we're going to go buccally. Alright, that's the lingual is the top of the abutment. Buccally is where the screw hole is. Dry the tooth. Out. A little less retraction. Dry the tooth. Yes, indeed, it is toward the buccal. So we'll follow that path. Okay. Okay. I got one fairly loose. We're going to go after the other one. Out, please. Rinse dry. Sorry. Rinse dry. So this is the top of the crown, the cement line, the housing, and then the screw within the housing. So this is the cement line. We need to find the housing, which is right here, and then to get through to the internal aspect. Nothing hollow yet on 14. So we're going to continue to slowly prep until we find the hollow point. We may have to go wider on this one to get into the housing. I went a little bit buckly, seeing a cement line, but that may be deceiving. So we'll follow a different path. Say out, please. Thank you. Okay. Suction dry. Okay. Let's look at the implant body. So here we are, straight up. I'll make our access a little bit wider. Rinse dry. Okay. Switch to a new 330. I'm going to take a little break, let you rest your mouth a little bit, and we're going to come right back and pick it up where we left off.